Hi everyone, my name is Shubhshara Mason and today I will be talking about what is idiopathic left ventricular tachycardia, which is also known as an ILVT. So what is idiopathic left ventricular tachycardia, guys? Okay, it is basically a arrhythmia characterized by a rapid heartbeat which is originating from left ventricles. As you can see in the name itself, there is left ventricles. Okay, what is idiopathic? Idiopathic means the exact cause of the tachycardia is unknown and not associated with any structural heart disease. And this condition or disease can occur in young or also in healthy individuals, and the symptoms of this disease is palpitation, dizziness and chest pain. Idiopathic left ventricular tachycardia originates from the posterior fascicles of the left bundle branch in the left ventricle. So it is a re-entrant tachycardia, meaning an electrical signals will travel in loop causing the heart to beat rapidly. The most common type, which is posterior idiopathic vascular left ventricular tachycardia, the re-entrant circuit starts in the basal of the interventricular septum, which is the wall between the left and right ventricles, and it will spread towards the apex, which is the tip of the heart. So there is two types of circuits, which is the antegrade and retrograde. So what is the antegrade? It is basically where the electrical impulses move forward from the basal region down to the apex, and retrograde is after reaching the apex, the impulses will travel back along the posterior fascicles to complete the loop. So next is the Purkinje fiber. So there might be an abnormal Purkinje fiber that may be involved, and this part of the circuit can change its speed, which is a key characteristic of tachycardia. And the last one is the sensitivity of to the medication. So this circuit can be influenced by the medication like verapamil, which helps to slow down the heart rate. So in order to diagnose this condition, there will be electrocardiogram. So as you can see the example that I have given, it shows that there is a fast regular rhythm with ventricular tachycardia and also a right bundle branch block and also a left axis deviation. For the characteristics of electrocardiography for this disease, there are a few things. The first one is that the QRS complexes will be wider than 120 ms, where the electrical impulses is not following the normal conduction pathway. And the second one is a rhythm is regular and it has a consistence of R to R interval. As I already draw over here, as you can see, there is P wave, QRS and T wave, and same goes to that. And as you can see, I have already drawn the arrow. It is consistent R to R wave throughout the whole thing. And next is the T wave inversion. As I already draw, this is how the T wave inversion might look. And since it's a tachycardia, the heart rate will be exceeding 100 beats per minute, which is more than 100 beats per minute. One of the most common type of idiopathic left ventricular tachycardia is known as idiopathic vascular left ventricular tachycardia, where this is a re-entrant tachycardia, which is typically of a young patient without structural heart disease. So this is the example ECG of idiopathic vascular left ventricular tachycardia. For the acute management, we are going to assess the patient's status, which means by checking how stable the patient is. If the patient is unstable, for example, they have a low blood pressure, we are going to have an immediate electrical cardioversion to restore to the normal rhythm. And for the stable patient, we are going to have a first-line treatment, which means by using the verapamil medications that will help to manage the heart rhythm by administering 10 mg of intravenously over 1 minute. For the long-term management, for an example, we have to look for the symptoms. If the symptoms are mild, we are going to give the medications. But if it is severe, if or the medication doesn't work, then a catheter ablation is recommended. So the other name for catheter ablation is also known as radio frequency ablation, which is basically a minimally invasive procedure used to treat certain type of arrhythmia, including the idiopathic left ventricular tachycardia. So this one, they use the radio frequency energy to create small scars in the heart tissue, disrupting the abnormal electrical pathway that will cause the arrhythmia.